I suppose one of the questions that I get asked most frequently in doing this work is, isn't it depressing to work with patients who have cancer? And in fact, it's not at all depressing to me. I mean, there's certainly very sad stories that you hear all the time. But I'm a psychiatrist, and I'm interested in people's attempts to live with life in the best way they can in the face of a lot of different challenges. And what I found over the years with cancer patients is that it brings everything into bold relief. And so if you're interested in trying to help people make sense out of their lives, make sense out of the challenges that they have and help them through it, there's nothing like sitting down with someone who's either just been diagnosed with cancer or in the middle of treatment or just having had a recurrence or perhaps facing a terminal phase of their illness, because fundamentally what I'm interested in is in talking with people about meaning in life, and there's really nothing else quite like cancer that kind of brings those big questions into bold relief. After working with cancer patients and their families for many years now, what I've been most impressed with is their resilience. In fact, the majority of patients who have cancer take it as a major challenge to themselves, but they actually do quite well during the process. That said, for many patients, it is the single greatest challenge that they've ever faced, and to a large extent, it represents both a psychological crisis, it's something of an existential crisis, thinking about the prospect of their own death. But there are also lots of symptoms that get in the way in the meantime, symptoms such as anxiety and depression. Very often you can have confusion, especially during the middle of treatment with many medications and sometimes radiation therapy. There are drug interactions that are concerns for many patients, and so the most important thing to remember is that people's lives have kind of been turned upside down for the time being, and that life as they know it kind of has either been put on hold or has been altered kind of forever in a sense, even if they have a terrific outcome with their cancer. So there are a range of kind of challenges at different times during treatment that we try to address. What we've put together is something that we're calling the Comprehensive Cancer Support Program, and it is an overarching program that we're hoping to tie together several components that are either currently in existence and that people at UNC are familiar with at this point, or will be new programs, and I'll just list those. The first is a program that's been in existence. Diane, you know this since you were involved in starting it. It's the Patient and Family Resource Center. And this is a terrific program providing a whole range of resources, educational resources, information about cancer, about its treatment, about nutrition, about exercise, helping people in a variety of ways find the information that they need and cope in a variety of fashions. And that's a program that's run by Tina Shaban, and to a large extent is the public face of what the Comprehensive Cancer Support Program will be consisted of. And additionally, we have new programs for survivorship that have been started in the last few years, and Liz Sherwood operates those. But one of the new aspects of this program is going to be a psychiatric consultation service for cancer patients in particular. It's a clinical consult service, and several of us will be seeing patients both on an inpatient basis and an outpatient basis, and the capacity to see outpatients is something that hasn't really existed as well as it should lately, and so we're looking forward to seeing patients as they transition outside of the hospital and as they move into a survivorship mode. Additionally, we're trying our best to put together a truly integrative approach to supportive care for patients, and we're working with the palliative care service and the symptom management service to put together a multidisciplinary clinic. And one of the things that is going to be new in the next year is going to be integrative medicine services, so that we will have the capacity to provide massage therapy and relaxation and meditation and yoga and acupuncture and lymphedema therapy, and we'll be doing that both at the North Carolina Cancer Hospital, but also in an outpatient setting called Carolina Point 2. One of the things that we're most excited about in getting the Comprehensive Cancer Support Program up and running is the capacity to reach out to the more remote areas of North Carolina. Clearly there are not enough psychiatrists and psychologists and social workers and nurses to with psychiatric training to kind of meet all of the needs in a one-on-one fashion. And increasingly what we're recognizing is that collaborative care models and telemedicine are opportunities to kind of get out to remote areas and help clinicians, primary care clinicians, family practice clinicians who are providing care for cancer patients. And so we're having a series of educational programs throughout North Carolina that we're planning. In addition, we're going to have a telemedicine program where where clinicians will be able to call in and consult. So every once in a while, multiple forces come to work at the same time and create a possibility to do something that is really unique and quite special. And I think what's happening right now at UNC with the UCRF and the leadership of the Lineberger Comprehensive Cancer Center and the health of the UNC healthcare system and the Department of Psychiatry and the North Carolina State Legislature has created a really wonderful opportunity to consolidate, organize, and integrate lots of services that will ultimately translate into better care for patients with cancer, and addressing some of the needs of the family members as well, and also provide an opportunity to study what we do and kind of how it works and what are better ways to do it. So what's most exciting to me about this time is the confluence of vectors that are coming together so that there's really a great sense of energy and enthusiasm and individual resources that will make this an exciting time to kind of pull a lot of different programs together.